Thank you for watching the recorded version of the Primary Care Fund Annual Application Review Conference for fiscal year 25-26 grant cycle. My name is Tracy Gonzalez with the Department of Healthcare Policy and Financing, which you'll also hear referred to as HICPUF throughout the presentation, and I'm your point of contact for the Primary Care Fund program. Today's agenda includes an overview of the application, data validation audit updates, primary care fund funding, and we'll wrap it up with program updates. Every clinic wishing to receive funds from the primary care fund program must submit an application annually. Application submission is done through the SharePoint platform, which is an external sharing site. Each agency has their own SharePoint profile page and must have registered users to access that. If you are a new applicant or a returning applicant that has had staff turnover and need to request a new user, please email the Primary Care Fund email address. Include in your email your organization's name, the name of the individual you're requesting access for, as well as their email address. They'll then receive an invitation to SharePoint and they can follow the instructions to complete setup. As always, if you have any issues accessing your SharePoint site, you can reach out to me and I can do some troubleshooting. The fiscal year 25-26 application was released on January 27th and can be found in a folder labeled 25-26. Now, SharePoint also houses all of your historical applications and supporting documentation. This is extremely helpful if this is the first time that you're filling out the application and you come across a question within the application that you're unsure of how to answer. You're able to look back at the previous year's applications as well as all of the supporting documentation that had been uploaded. The application is in an Excel workbook and consists of a total of 27 tabs. When opening the workbook in SharePoint, there's been issues of not being able to see the entire content of a cell. What I recommend doing is opening the application in the desktop app. You can do this by clicking on the viewing option at the top of your toolbar and then selecting Open in Desktop app. This will allow those cells to open up a little bit where you can see the entire contents. This is also nice because it will continually save to SharePoint. So if you're like me and you're working in different screens and different programs, you're not having to go up and click save every 5 minutes to save your work. It is automatically saving to SharePoint. You also have the option of downloading the application to your desktop and just working on it at your leisure. Now, if you do download the application to your desktop, you'll want to make sure that you are uploading that back up to SharePoint once you're ready to submit. The first tab is the table of contents, so this will show you exactly what's in the application. The introduction tab includes an overview of the Primary Care Fund program. The program is funded from Colorado's tax on cigarettes and tobacco products. 19% of the total tobacco tax collected throughout the state of Colorado is allocated to the Primary Care Fund program. The goal of the Primary Care Fund program is to support community health centers and other safety net clinics by awarding funding based on the number of low-income uninsured patients that the agencies serve. The definition tab includes terminology and definitions to assist in understanding language used within the application. The timeline tab has the timeline of the fiscal year 25-26 application. And the instruction tab has the application response instructions. The response is due on May 23rd. We ask that you please do not convert the workbook to a PDF. Please leave it in the Excel format. Remember to keep all documentation for 5 fiscal years. And as stated in the instructions tab, all materials submitted during the application submission becomes the property of the state of Colorado. There's also the code of the Colorado, there's also a link to the code of the Colorado rules and regulations. I recommend visiting this link to refresh yourself on the rules of the Primary Care Fund program. Also, if you have new staff working with the program for the first time, this is a good link to direct them to so that they can familiarize themselves with the program. The checklist tab has an area where you are able to mark down whether or not you have completed tasks. I think this is helpful as you're filling out the application. Once you complete a task, you can mark it off as done. There's also a link to the Primary Care Fund frequently asked questions. This is a good link to give new employees as well. There's a lot of good information on there. And if you have questions that you think should be on our FAQ, please submit them to me via the Primary Care Fund email address. The agency information tab needs your agency's information, your legal name, your federal employer identification number, mailing address, your primary and secondary contact information. Down on the bottom of this page is your average cost per visit. There's no set formula for this. The example that we use in the application is the UDS medical cost per medical visit formula. But again, there is no formula. This is your clinic's average cost per visit, but it does need to be filled out. Up in the upper right-hand corner are a set of 3 check boxes. The first is as to whether or not your clinic is a federally qualified health center. The second is whether you're a corporation, partnership, or other. And then the third set of check boxes is your certification and licenses. Please upload a copy of your certification to SharePoint and make sure that it has the duration of accreditation stated on it. The applicant history tab is your agency's mission and history. This tab must be completed by new applicants and those clinics that were notified to fill out the entire application. Question 1 has a few different components to it. The first is the freeze date. The freeze date will act as a point in time in which your data is fixed and definite so that the count can be made. The patient's visit closest to your freeze date is the source designation used in your application. The unduplicated patient count should be calculated on a specific point in time occurring between the end of the applicable calendar year and prior to the submission of the application. Let's dig a little deeper to what the patient count is. Your unduplicated patient count is the sum of patients who have had at least one visit and received at least one of the services under the definition of comprehensive primary care during the applicable calendar year. It should not include counting a patient more than once if the same patient returns for additional services and/or products during the applicable calendar year. Should not include counting a patient more than once if the payment source designation changed during the calendar year. Should not include individuals who have only received services through an outreach event, such as a community education program, a nurse's hotline, or other types of community-based events or programs that are not documented on an individual basis. Individuals who have only had services from large-scale events such as mass immunization programs or screening programs, and individuals whose only contact with the applicant agency was to receive special supplemental nutrition program for women, infants, and children counseling or vouchers that are not users of your clinic and that the contact did not generate an encounter. The patient can only be included in one of the payment source designations listed in the question 1 table. The patient's payment source designation in the application response should be the payment source designation listed for the patient at the last visit closest to the freeze date. So we're going to take a look at a few examples. For this example, the clinic's freeze date is April 1st, 2025. We're looking at the patients that were seen during calendar year 2024 up until their freeze date of April 1st, 2025. Patient A was seen on January 20th, 2024, at which point in time they had Medicaid as their payment source for the visit. They were seen again December 11th, 2024, when they were uninsured, and they came back again February 15th, 2025. They had Medicaid again as their payment source for that visit. Since the February 15th, 2025 visit was the last visit closest to that freeze date of April 1st, Medicaid is going to be the payment source designation used in the application response. So we'll look at patient B, who was seen 2 times during that calendar year. They were seen February 15th, 2024, in which they had a third-party payer. They came back again December 15th, 2024, and they were uninsured. December 15th appointment is the appointment closest to the freeze date of April 1st. So uninsured would be the payment source designation used in the application response. The question 1 table is your agency's unduplicated patient count and the methodology used to calculate your low-income uninsured patients. You're going to start off with your freeze date, and please remember to include your freeze date in the application. The next step is step 1. You're going to identify the total number of unduplicated patients served by your agency during the calendar year of 2024. So from January 1st, 2024 to December 31st, 2024, or to your freeze date. So for this example, I use 12/23/20, 12/31/24 as the freeze date, and I entered 200 unduplicated patients. Moving on to step 2, we're going to begin deducting patients that have A, Medicaid, either primary or secondary, B, CHP plus, C, any other type of reimbursement for healthcare costs by a government program. So that's your Medicaid, Social Security, Veterans Administration, etc. And then step 2D is any other third-party payer not mentioned above, such as private insurance. So once I bucketed all my patients in step 2, step 3 auto-calculated and gave me a total of 100 uninsured patients. From step 3, we are going to deduct how many of those uninsured patients are at or above 200% of the federal poverty level. So please keep in mind that these are patients whose incomes were exactly at 200% of the federal poverty level and above. Step 5 is going to auto-calculate for you again, and this is your low-income uninsured patients that are below 200% of the federal poverty level. Keep in mind that any patients whose federal poverty level is unknown or undetermined should not be included in your step 5 patient count. So again, this is your low-income uninsured patients whose federal poverty levels are below 200% of the federal poverty guidelines, and this is the number that your award is based on. The current primary care fund rule defines a medically indigent patient, which is your step 5 patients, as a patient whose yearly family income is below 200% of the federal poverty guidelines. A patient who is not eligible for Medicaid, CHP Plus, Medicare, or any other governmental reimbursement for healthcare costs, and where there is no third-party payer. There are a few programs that can be a little confusing when calculating your Step 5 patients, so we'll take a look at Women's Wellness Connection, or WWC. WWC reimburses a limited set of services on a per-patient, service-specific basis. Therefore, WWC patients should be categorized under Step 2C in your application, which is any other type of reimbursement for healthcare costs by a government program. However, if a patient has received WWC services, but they also receive other comprehensive primary care services at their appointment, they may be included in your clinic's Step 5 patient count if the patient was charged a sliding fee scale copay for the other comprehensive primary care services they received, and if the services are distinctly documented in your billing system. Ryan White HIV/AIDS program is another program that can be a little confusing. The program has 4 parts to it. The first 3 parts, a grant recipient can be included in the primary care fund Step 5 patient count, but we will require supplemental documentation supporting which part of the Ryan White HIV programs have been awarded, and that must be submitted with your primary care fund application. The applicant will also need to discreetly identify what type of Ryan White fundings were received. So, for example, Part A, you received $50,000 for that. That also needs to be uploaded with your application to SharePoint. Part D of the program is associated with specific patients and services. Therefore, those patients seen under Part D of the Ryan White HIV/AIDS program should be categorized under Step 2C. Again, any other type of reimbursement for healthcare costs by a government program. Patients seen for immunization or vaccines can be included in your Step 5 count if they are an established patient that you have record for. If the immunizations or vaccines were given in office or in the pharmacy and not at a mass event or something the federal government is funding, and of course, if they are not covered by a third party. The last piece of question 1 is your source of data. I know some of our participating clinics have numerous locations where they see patients at. This is where you are going to list all of your locations. And this is important because if you are chosen for an audit, the audit team will be tying back from the data that you submit to them, the locations where you're seeing a patient. So if the data that the audit team receives says that you saw John Doe at Sunnyside Clinic, and they take a look at your question 1 source of data and they don't see Sunnyside Clinic listed, that's going to be a finding. If you run out of room in the application to list all of your locations, you can create an Excel sheet and upload that to SharePoint. Just make sure that you let me know that that's what you've done so I can be on the lookout for it when I'm reviewing your application. To meet the qualifications of a primary care fund provider, the provider must accept all patients regardless of their ability to pay and use a sliding fee scale for payments or not charge the medically indigent patient for services. The sliding fee scale is a tiered copayment system that determines the patient's level of financial participation and guarantees that the patient's financial participation is below unusual customary charges. Factors considered in establishing the tiered copayment system shall only be the financial status and the number of the members in the patient's family unit. If a provider is charging patients on a self-pay rate that is outside of the provider sliding fee scale or not at a $0 rate, Those patients are not to be included in the final Step 5 patient count and should be eliminated during the methodology process on the primary care fund application. The sliding fee scale tab asks you to summarize your policies and procedures regarding your sliding fee scale. We do expect a minimum of 2 sliding fee scales. However, depending on your freeze date, you could have up to 3 sliding fee scales. The important thing here is to remember that your sliding fee scales must cover the duration of your application. So if you have chosen May 1st as your freeze date, your sliding fee scales should cover from January 1st, 2024 through May 1st, 2025. Please also remember to include in your sliding fee scales the dates that they're effective for. That's very important as we're looking at the patient's visits closest to the freeze date. We need to be able to tie that back to your sliding fee scales. We do need corresponding copayments for each sliding fee scale. So even if your scale and copayments have not changed, we still need documentation that supports your data. The outside entity tab includes the criteria and requirements of your outside entity. We do require your outside entity to sample a minimum of 25 patients. Please ensure that your outside entity is sampling the patients counted to your freeze date. So if your freeze date is beyond that December 31st, 2024, make sure that your outside entity is sampling through your freeze date. They're not just stopping at December 31st. They're sampling patients up to your freeze date. Clinics required to increase their sample size due to data validation findings during the fiscal year 24-25 application audit will be notified by the end of March. We are still wrapping up audits, so I don't have that information right now, but I am hoping to have that by the end of the month. The confirmation by applicant agency needs to be signed by an authorized representative confirming that all the data and documentation submitted during the application response is accurate and true. HCPF offers a waiver that allows clinics to waive questions 3 through 6 of the application. The waiver exists if a grantee has been awarded funding within the previous 3 years, if the grantee meets the eligibility criteria of a qualified provider, and they certify that there has been no changes in their capacity to meet all eligibility requirements. The waiver does not apply if you are a new applicant, so all new applicants must complete the entire application. It also does not apply if you have been notified that it is your turn to complete the entire application, and you can expect to complete the application in its entirety every 3 years. Notifications to selected providers who must fill out the entire application were sent on February 3rd. I do have PDF versions of the waiver, the confirmation by an outside entity, and the certification. I have PDF versions of all of those. So if you run into issues downloading those, you can reach out to me and I can email you the PDFs of those. Question 3 is the medically underserved area or population tab. If your agency provides services in an area that has a medically underserved area or medically underserved population designation, so MUA or MUP designation, please provide the county name, designation type, service area name, and federal ID number. If your agency provides services in an area that does not have an MUA or MUP designation, please provide evidence and cite sources that demonstrate that your agency serves an area or population that lacks adequate healthcare services for low-income uninsured persons. The question 4 tab question 4 consists of a total of 7 tabs. Those tabs include primary care, maternity care, preventive, developmental, and diagnostic services for infants and children, adult preventative services, diagnostic laboratory and radiology services, emergency care for minor trauma, and pharmaceutical services. Completion of the question 4 should demonstrate that the applicant agency has a track record covering a consecutive 52-week period prior to the submission of the application of providing cost-effective care, and that the applicant agency will continue to provide or arrange for comprehensive primary care services to persons of all ages on a year-round basis. Agencies not providing any of those components of comprehensive primary care services to persons of all ages on a year-round basis must provide documentation of an established referral relationship. This is not a new requirement, but I think it's important to point out what the expectation is. So, for example, if your clinic is an age-specific clinic, you're only seeing patients to the age of 18, you must have an established referral relationship in place where you can refer patients above the age of 18 to receive services on your behalf. That can go for pharmaceuticals or radiology. If you're not able to provide those services for your patients, you must have an established referral relationship in place where you can refer patients out to receive those services. The established referral relationship is a formal written agreement in the form of a letter, a memorandum of agreement, or a contract between two entities that includes the comprehensive primary care and/or products to be provided by one entity on behalf of the other entity, any policies, processes, or procedures that are in place, the guarantee that the referred low-income uninsured patient shall receive services on a sliding fee scale or at no charge, and it must include signatures by representatives of both entities. The only exception here is emergency care for minor trauma. We do not require an established referral relationship to be in place for emergency care for minor trauma. Question 5 tab is the eligibility screening. This is the process your agency has for screening patients' eligibility for Medicaid, CHP Plus, and CICP, and your process for referring those patients that are potentially eligible for any of those programs to the appropriate entity. Question 6 is the Quality Assurance Program. This is a formalized plan and processes designed to ensure the delivery of quality and appropriate comprehensive primary care. Agencies who have not received certification or accreditation through the Joint Commission on Accreditation of Healthcare Organizations or by the Accreditation Association for Ambulatory Healthcare shall complete the questions within the Question 6 tab to demonstrate how all of the components set forth for a quality assurance program as defined by the Primary Care Fund are met through your agency. Applicant agencies that have received certification or accreditation shall submit a copy of the official documentation. Please again make sure that the dates of your accreditation or certification are clearly on those documents and uploaded to the SharePoint profile page. Now you've finished filling out your application. We've gone through all of the tabs and it's time for you to submit. Please make sure that you have completed the application in its entirety. I still recommend using the checklist to make sure that all those tasks have been completed, and then upload your supporting documentation to SharePoint. That's your sliding fee scales, your certification, your licenses, your established referral relationship if that applies. Make sure that all that supporting documentation is uploaded to SharePoint, and then email the primary care fund email address that you have officially submitted. And again, the application response deadline is May 23rd. All right, data validation audits and common findings. HCPF is required to conduct annual audits on the primary care fund applications. The audits consist of a comprehensive review of the primary care fund application and supporting documentation. We remind you to keep all documentation used to complete the application for 5 fiscal years. Organizations selected to have their fiscal year 25-26 application audited will be notified in the coming months, and agencies can expect to have their applications audited approximately every 3 years. Some of the common findings that surface during the audits are not counting secondary insurances, not verifying yearly income is below 200% of the federal poverty level, not charging appropriate sliding fee scale copays, counting self-patients inappropriately, and not keeping the documentation to support your application. So that's your patient count, your federal poverty levels, and those charged copays. The audit team has given a few tips. Again, please keep the unduplicated patient count used for your application. We have moved the audit timeline up a little bit, so it is happening closer to the time that you submit your application. So your unduplicated patient count and the methodology you use to bucket your patients in that question 1 table should be fresh. You should have it. So I would recommend when you're filling out the application, keep your unduplicated patient count, throw it in a file on your desktop so it's ready to give to the audit team should you be selected for the audit cycle. Once the audit team receives your unduplicated patient count, they're going to sort through it and try and mimic how you bucketed your patients in that question 1 table. They'll then send you a sample request. The sample request data should include all visits for that calendar year for the patients that they are sampling, all of the patient's charges, as well as all of the patient's copays. Moving on to the funding of the primary care fund program. This graph goes back from fiscal year 2016-17 to the current fiscal year that we're in now, which is fiscal year 24-25. As you can see, there has been a decrease, a dip in the total tobacco tax revenue collected throughout the years. So looking at the final primary care fund awards for fiscal year 2021, we received a little over 24.6 million. We see a huge increase in fiscal year 21-22. That was due to the fact that we began drawing down the federal matching funds for Medicaid providers. So we did see our awards for fiscal year 21-22 increase to a little over 51.5 million. Medicaid providers will continue to receive state funds in addition to the federal matching funds for fiscal year 25-26. The budget appropriation for fiscal year 24-25, which is the fiscal year that we are in now, and this is the total tobacco tax revenue and general funds, it's not including the federal match. That budget appropriation was set at a little under 24.7 million. Now, again, remember that this is an estimate because we do not have the final tobacco tax collection as of today. So that's just an estimate. We're hoping that that will stick. We'll see what the tobacco tax revenue ends up being. For fiscal year 25-26, the application that you're working on now, the estimated appropriation is just shy of 18.5 million. So as you can see, there is a slight decrease in the estimated appropriation for fiscal year 25-26. However, we will not know for certain until the approval of the long bill. We will continue to pay 90% of the appropriated amount and adjust based on need when comparing to the appropriation. We do this to be more in line with the actual revenue received and help prevent drastic shortfalls in the fourth quarter payment. And we will true up to the actual tobacco tax received in the fourth quarter payment. So there are no changes there. We do make every effort to issue quarterly payments on time. However, payments can always be delayed if there's not enough tobacco tax collected during each quarter to cover the quarterly payments. And the quarter four payment will be delayed as we reconcile the end of the fiscal year and the final tobacco tax received. There was a change to the payment distribution of the quarterly payments. On January 29th, clinics were notified via email of the approval of State Plan Amendment 24-0030. This is allowing quarterly payments to come directly from HCPF. This is helpful because clinics are receiving funds sooner and more efficiently. So those clinics that were receiving the payments through Children's Hospital, that will no longer happen. Payments will come directly from HCPF. This is also helpful for me because if a clinic has a question on a payment or they need to change their banking information, I can handle that in-house now. And I want to point out that there was no structural impact to the program. So the only thing changing is just that payments are now coming directly from HCPF. We will wrap it up with some program updates. We'll be meeting with the Medical Services Board to request a change to the primary care fund rules and regulations. Effective July 1st, 2025, the Colorado Indigent Care Program, or CICP, will be repealed from House Bill 24-1399. So therefore, all references within the current primary care fund rules will be removed. We'll also be changing the definition of medically indigent patient to eligible patient and also to include patients at 200% of the federal poverty level. We are doing this to be more in line with other programs and sliding fee scales and to avoid confusion. So the current rule reads medically indigent patient. It gives the definition of medically indigent patient as a patient whose yearly family income is below 200% of the federal poverty guidelines. The proposed rule will replace medically indigent with eligible. So the definition for eligible patient will then be changed to part one of the definition, a patient whose yearly family income is at or below 200% of the federal poverty guidelines. And then since CICP is sunsetting, CICP verbiage within all of the rule will be struck out. It will be removed. So what does that mean? Beginning July 1st, 2025, number one, medically indigent patient will no longer be in rule, and we will stop referring to the patients as being medically indigent. You will see that replaced as eligible patient and also as low income uninsured patients. And then also beginning July 1st, 2025, clinics can include patients that are at exactly 200% of the federal poverty levels in their step 5 patient count. So currently, you are able to include those patients that are at 0% up to 199, so below 200% of the federal poverty level. Beginning July 1st, 2025, you will be able to begin counting patients that are at exactly 200%. So important to remember that January 1st, 2025 through June 30th, 2025, it is business as usual. This is going to affect your 2026-27 application. So the application that you're working on right now for fiscal year 25-26, there are no changes. This is not affecting this application. But your 26-27 application, which is going to be covering calendar year 2025, will have a mix of medically indigent patients. So when looking at the last visit closest to your freeze date in that application cycle, you're going to be looking at those patients from January 1st, 2025 up until June 30th, 2025. And those patients you will be counting below 200% of your federal poverty levels. However, beginning July 1st, 2025 and beyond, you will be able to include patients that are at exactly 200% poverty level on your application. So please pay close attention and keep an accurate record of your patients' federal poverty levels throughout calendar year 2025. A few reminders. I've received quite a few intent to applies, but if you have not submitted your intent to apply, that is due Friday, April 11th. Please email the primary care fund email address with your agency's name, your primary and secondary points of contact, as well as their email addresses that you are intending to apply for the fiscal year 25-26 grant cycle. Application responses are due by close of business on Friday, May 23rd. So again, make sure that you have completed the application to the best of your ability. Upload all of your supporting documentation and email the primary care fund email address that you have officially submitted your fiscal year 25-26 application. And tentative award notifications will go out on Monday, July 7th. Again, a reminder to visit the frequently asked question page on our website. And here is my contact information. You can reach me by emailing the primary care fund email address. I've also included a link to the primary care fund provider information page on HCPF's website. This is great information. Again, a good link to have to give to new employees so they can familiarize themselves with the program. And if you're a new clinic, I recommend visiting this website, and it's got all of the application timeline on there. It's got the actual application. It's got the links to the rules and regulations as well as the state statute. So it's a good link to have. Very informative. And of course, you can always reach out to me, as I said, via the primary care fund email address for any assistance that you need. And I look forward to working with you in fiscal year 25-26. Thank you for watching.